Patient-centered care. Care is considered the act of nurturing another individual to whom the first individual feels a commitment or a responsibility. Caring is foundational to the role of the nurse. Watson's theory of human caring is a model of client care that adopts the holistic healing perspective, and it is characterized by transpersonal care. The goal of caring is for the nurse to assist the client to achieve mind, body, and spirit harmony. Swanson's theory of caring views caring as a process that the nurse utilizes when demonstrating the caring abilities toward another. For active listening, it is careful and intentional listening, and this is vital to nursing assessments and nursing caring. Listening needs to be active. Touch. This is the use of touch in interactions with clients. The professional care administered by a nurse requires physical contact. Being present is the unique ability to give the gift of presence to others. Providing comfort. Individuals crave comfort during times of personal or other distress. It is the nurse's responsibility to provide comfort through various nursing interventions. Showing compassion or compassionate care is achieved by recognizing pain, suffering, and taking actions to help alleviate pain or suffering. The focus for compassion is humanizing factors in the art of nursing. For client preferences, the participation of the client as a member of the healthcare team is vital. This is a deliberate inclusion in their own care that will help create a sense of trust and healing environment, while it increases the sense of control or power for the individual client. The nurse needs to provide culturally competent care because culture contributes to overall health. Culturally competent nursing practice is the application of evidence-based nursing that is aligned to an individual's preferred cultural values, beliefs, and practices. The nurse must consider any age-related instances. For a nurse, they must have a generalized awareness of common generational differences, identify any communication barriers, and realize that individuals have preferences based on age, experience, and upbringing that must be incorporated into their care. Spiritual nursing care understands that clients are holistic beings, and nursing care is holistic care. This means that caring for both the physical and the spiritual being are necessary. Spiritual distress is identified as an uncomfortable feeling that can be related to questioning life's meaning, belief system, or anger toward a higher power or the universe. This spiritual distress can produce despair, anger, uncertainty, and fear. Spiritual support is provided by the nurse. However, many nurses do not feel prepared to provide spiritual support. The nurse must remember that spirituality and religion are often linked and tied to cultural beliefs. When promoting access to care, Healthy People 2020 defines access to care as a timely use of personal health services to achieve the best possible health outcomes. This includes health insurance coverage, lack of transportation access, and any restriction on healthcare resources. Advocacy for nursing, this has been a long tradition for the nurse to provide client advocacy. This is included in the American Nurses Association Code of Ethics for Nurses. Advocacy is seen as protecting rights, interests, and safety of clients, especially when they are at their most vulnerable. The nurse will aid the client and the caregivers in determining the priority, whether it is life of quantity or a life of quality. A quality of life is the fulfillment of the client's purpose and meaning of their life. Pastoral care is a client-focused service. This provides support with ethical, spiritual, and religious needs. Pastoral care also provides responsive and multi-faith services that are focused on an individual's relationship with themselves, others, and their higher power.